Well, hello and welcome to another Thursday Live. I'm Dr. Jerry Dreessen with the Association of PEMF Professionals, the AOPP. And again, as we did last week, I want to welcome you to 2026. We've got some really cool stuff going. And if you have any questions or comments about the new things that you're doing this year or some revelations you got from last year that you're implementing, definitely drop them in here. My mic was peeking out there. I got too excited. All right, so let's just kind of dive into it. What we want to do today is talk about from anecdotes to evidence, the universal PEMF session note template. So, what we want to do is arm you with some tools that you can begin to use that helps you in your business, and again helps us look more in the professional realm to other professionals versus just showing up with a machine saying, "Hey, can I do PEMF?" You can have the shirt with the oops over here. You can have the shirt with a logo on it with your business. You show up, you look professional. Everything's branded with your name. You're going to be presented more as a business entity versus the people that we are with the intent of helping other people. But once you get going and you start knocking on doors of other professions, if you can implement these strategies that I'm going to talk about today, it's definitely going to get you across the goalpost and getting more clients, more customers, being able to get through the gatekeeper into more doors. And again, if you're not part of networking groups, that's definitely a great place to go where you can begin to show what you've got and start networking with the in a networking group. There's always like that cluster of healthcare professionals, and if you can tap on that door and get in there, then you'll be able um, to get going. Oh yeah, Austin, good point. He's up here over on LinkedIn on our live broadcast. But yes, um, when we feel good, business runs better too. So I agree with that too. But you can kind of tell when somebody's talking with you if they're having a good day or not. And if you are having a good day, then more people will be more than happy to talk with you. So good point, Austin. So last week we talked about the employment survey and what it says about the profession. This week it's kind of a natural step forward, what we can do as practitioners to move PEMF forward. And literally a profession isn't just people doing a modality, it's people using consistent processes, language, documentation. When you go to a hospital, you expect certain things to happen, a form being filled out. You expect like there being a nurse, the front desk receptionist, being put in a room. You get your height, your weight, your blood pressure. Doctor comes in, reviews your chart. I mean, there's a whole process that's actually templated. And if you can turn what you do into a process that's repeatable, it's going to free you up from having to like, oh God, what did I do? But the more systems, repeatable systems in place, the better off you do too. And then there is when someone asks, how do you know it's helping? And then we need more something solid than because we here at We Say So, we say you're getting better. But no, if you've got things in place that demonstrate that. And again, in the healthcare profession, there's feeling and there's function. So people can feel better, but medication will do that. But if they're actually functioning better, like they can bend down and lift without pain, or their range of motion improves, or the swelling is decreased. If you can show objectional changes towards their function, that's really where the rubber meets the road as far as proving things. So basically, we're staying firmly in the wellness lane today. What I want to talk about and comfort, function, recovery, stress, sleep, performance, readiness. Again, there's no medical diagnosing or treating. So those are the buzzwords that we want to use today too. So Let me shrink myself down. We'll bring up the slides and let's jump into this sucker. So a quick question. Do you currently track anything after your sessions? And if you don't, we want to show you how to do that because it's really important. And again, whether it's just writing them down on a notepad, you've got like a 3-ring binder, and each day you're just making notes like a journal, or you got a like a diary or something where you're writing stuff down. That's fine. But if you have an actual form that asks you the questions that you need to ask and you stay consistent, that's what's really cool. So we kind of broke it down. Really, there's only 5 things that you need. So the client owner goal, like what in their words, what brings you here today, or what do you expect to get out of this? What's bugging you? And so oftentimes when we do a sit down and do the subjective consultation, anytime they say what their goals are, we write it down and put it in quotes. And again, that's what the goal is. My goal is to be able to pick my child up without back pain. It's like, okay, that's in their words. So, and then also a baseline rating. So 0 to 10 scale. And then the session basics as far as the time, the general approach and placement notes, and then the post-session rating and follow-up prompt. And then the next step plan. So some people have had PEMF before, so they know what to expect. Others have never had it before. So if you can have your pre-talk, your talk while it's happening, and your post-talk, again, they need to know what's happening. I like to use PEMF on somebody that's never had it before, to turn it on, and if you have the ability to set it on a high, and then just hold it over their quad on a human side. Just hold it over their quad, so as you get closer, they can feel it. And that's where I tell them is that this is a different type of therapy. It's not electric; it's magnetic. And as you can tell, I'm not even touching you with it, and you can feel it. And you're wearing clothes, so I don't have to stick it to your body, which means this is not an electrical modality. It's totally different. And I'll turn it down in a minute, but I just wanted you to experience what it felt like. And once they make that brain-body connection, then you're good to go. So of those 5 things, for you, which of those do you do consistently? And if you're doing at least one of them, give yourself 10 stars and make them be gold stars. Now, if you want to get, 10 blue stars, then you got to, bump up your game and grab another one of these 5. But the universal template that I'd like to talk about is the visit info and the client type. So how do we break that down? Well, again, the wellness lane is where we're going to be, and on that screening is the section isn't fear-based, it's professional, and we're not diagnosing, we're just documenting what we were told or what was observed. And so if something is outside of that scope, that is, where referred out or clearance recommended. So if somebody says, well, I've got a broken bone, it's like, what do you know? Or they say my wrist might be broken. Again, what do you have in your degree that allows you to diagnose a broken bone? And so, and again, if it's family, it's kind of a different ballpark, because now it's like, I fell down, I hurt my wrist, it's a little swollen. Can we just do PEMF on it? It's like, yeah, let's do PEMF on it. Now, as a practitioner, it's like, well, we throw a tuning fork on it, see if it hurts. Then we take an X-ray of it to see if it's cracked. Those things. But make note of it, and what your recommendations were. That way, if they say, well, I saw this PEMF person, they didn't say anything about getting X-rays or having it looked at, and if they call you and say, no, in my notes it says directly, I told them to call ER or whatever it was that you put in there, and that's a way to save yourself. And then Karen asks me to talk about the baseline more. So yeah, good question. So baseline on the person is, uh, what's your idea of a or animal? Where are they to start out with? Um, you know, I'm trying to break down, like when we do our consultations. There's the height, weight, um, what their pulse is, what their blood pressure is, what their demeanor is when they walk, what their gait is, and then how they appear, what their conversation is, if they repeat themselves. There's all of those things that we use as a baseline for you. Like when they're sitting down, what's their demeanor, what's their conversation like. And um, Mrs. Johnson is a 65-year-old female. She's postmenopausal. She comes in today with low back pain demonstrated by grimacing while she sits down and stands up. I did a range of motion, and she could only bend forward 20 degrees with pain. Extension was 5 degrees with pain. Left lateral flexion was 15 degrees with pain. Right lateral flexion went all the way over to 45 degrees, no pain. Could sit down with her arms folded and rotated left and to the right, and no back pain. She demonstrated on her left hip, just next to the spine, that was the center of her pain. And I asked her if I could touch the area, and when I did, she noted that was tenderness and pain while I was touching it. So that establishes some kind of a baseline, so that on the next visit, those range of motions can be looked at again. The positive riser sign, where they stand up and they grunt. The old man grunt when you sit down and stand up. Um, and then also, now when I put pressure on it, it doesn't hurt. So what is it that they have that you can write down, that the next time you see them, you can check again to see if there's been a change? And so that's the broad definition of baseline. So hopefully that helped you, Karen. Now, I can support comfort and recovery in the wellness lane. And if you have concerns that need medical evaluation, I want you working with your veterinarian or physician too. So that's the catchphrase that you can have, write that down, or something similar to that. So if they say, well, what can you do for me today? And this is the phrase, well, I can support comfort and recovery in the wellness lane. But if you have concerns that need medical evaluation, then I want you working with your doctor, or I want you working with the vet if your animal has blank. So that's, again, a catch-all. It establishes who you are, what you can and can't do, and what the expectations are. So again, here we go, Karen. So like the baseline snapshot, you can use like a 0 to 10 rating on these things too. And you can develop your own, because again, humans are going to have one, large animals are going to have one, work animals are going to have one, small animals, pets, they probably all have different forms of a baseline that you want to check off in grade 0 to 10, and it may only be 5 things. It depends on what you want to track, so it's up to you what you want to make. But the baseline is the difference between a feeling and a pattern. So it's like, no matter what I do, that spot in your spine is still hurting. So you should go get that looked at, because it could be a ruptured disc. They may not even know that they have it. It could have been from a cough or a sneeze. So, but it's something that doesn't go away, and you've been tracking it, so you can definitely show that to them, and they see it too. You can use 0 to 10 ratings for comfort, for function, as far as stress, sleep, energy. Again, simple, repeatable, and consistent. So, how you feeling today? 0 to 10. How's your body bending? 0 to 10. What's your stress level? 0 to 10. How are you sleeping? 0 to 10. And, how's your energy? 0 to 10. So those are things you can map out with that visit. And with animals, also do an observable marker as far as the gait, the posture, the demeanor, willingness to move. And if you had to pick just one baseline rating to start using tomorrow, what would it be for you? Would it be comfort? Would it be mobility, stress, sleep, energy? What is it? What is it? The thing that your PEMF device helps with the most, maybe, so you can show that it is working to both of you, right? So the next is session and plan, plus the parameters. So again, we recommend that you are device agnostic on it. I mean, you don't have to be. So if again, you don't have to be talking about cola. You can be talking about Coca-Cola. But in essence, all PEMF devices perform a certain task to help change these things that we are tracking. So, here at the AOPP, we are agnostic on devices on purpose because there's so many that are out there and they all do great jobs. So, notice that we're not doing brand names, proprietary settings, or claims when we're talking about this. But if your device does go up to 11, use it. That's a Spinal Tap reference for those of you that know Spinal Tap. But again, use categories like low, medium, high, general placement notes in the language. And you can talk about the attachments, like you used a pad attachment, or you used a small double loop, or a small pad, or a large double loop, or a butterfly loop. Those are all things that can be talked about, and I would recommend them because it lets you know. Back in November, Mrs. Johnson came in with low back pain. You had her sitting on a pad, and you did it for 10 minutes on medium. And she was wearing thick jeans at the time, so she could feel it on the setting that I had, or couldn't feel it, but afterwards she was able to stand up, noticed a significant difference in how she felt. She was able to bend down 50 degrees as opposed to 30 when she started. That's, if you had to go back into your notes, like she would say, I don't know if this is working. Here we are in January of 2026. You say, well, back in November when I saw you, we did these things and that was your outcome. And I wrote that down. Remember? They go, oh, yeah, I totally forgot about that. Thank you. That's the magic in taking notes. So, and then in plain language. So it makes consistency across the devices and also keeps it professional. But when you're talking in front of a group of other PEMF professionals, you can just say, I used my device. I used it on the medium setting. And this is the results that I got. But if you stack the modalities, document it. So we used ice, we used heat, PEMF, we used infrared, because stacking affects the response and also the interpretation of the outcome is different. Again, if you use anything else, compression or vibration or anything like that, the more information of that visit you can put in, when you see a good response or a bad response, you've got that information to help you. So quick example language, low intensity, 20 minutes, general balance, targeted support to the back and the hips. Client was seated, and we did intervals with repositioning. I have to put this up there. Tina, yes. That's on the human side. No, I hope that you were going along with the joke. There's a movie called Spinal Tap, and they had this speaker system that, and it usually goes up to 10. They had one that went up to 11 because they're talking about when they were playing really loud, they wanted to just take it up one more notch. They would turn it up to 11. So that's you could probably find that on the internet too. So then, as we go into a mock scenario again for human, the goal was to have a looser back after a long day working at the desk. So baseline comfort was a 4 out of 10. Their function was a 5 out of 10. You did a 15-minute session. It was on low, medium, general, and then you targeted the back and the hips. Afterwards, the comfort was now a 6 out of 10. So again, you have to 0 to 10 is what you need, and is 10 better or is 0 better? So you have to state that too. In our line of work, 0 means nothing and 10 is the worst. So always make that be a reference for what you're doing. So, they felt better, 6 out of 10. 10 is best on this chart, functioning 6 out of 10. And then following up in the next session is in 3 to 5 days. Tina, I'm glad that you asked because, yes, no, we don't talk about actual spinal taps. I forgot that that could have been a possible answer for that. And then let's see here. Here's a mock scenario for animals. So again, the goal is post-travel stiffness and recovery from that. So if they, like a Washington horse, they travel and they winter in Florida. So, or you're taking them to shows. So the post-travel stiffness. And again, baseline mobility, whatever you use to measure that with, it's 5 out of 10. Calm, they're 6 out of 10. And as far as noting the short striding, how they do. So there's a 20-minute session on low, just a general system that was on there with a little bit of repositioning. Again, you can talk about where on the animal you positioned that and where you moved it around. Then afterwards, they were moving better and they appeared more calm. The trainer said they were a lot more calm. Their eyes looked more calm. Just the things that you use to make that general note. And here's the thing: you've got a phone. You can take a picture of them before and after. Same thing with people. You can video them before and after. So don't limit it to just paper and pen. But if you want to, use your phone, or if you've got an iPad specifically for this, take before and after pictures too. And again, what's the follow-up? Well, better movement, demeanor, what the workload tolerance is. So again, work with the trainers with animals or the owners and find out, what it is that they want to have happen. So how this builds the profession, again, this is the bridge between the employment survey and what comes next from what we did last week. But when lots of practitioners track the same basics, which is why we're trying to unify and make this more of a generic system, but then we all start talking the same language, and it helps us demonstrate the patterns without stepping outside appropriate scopes. So as you're tracking these things, again, if you send us this information, we can throw it into our database. And if our columns are all trackable and you're giving us the same information and we don't have to recreate more columns down the line as far as the differences, whereas it could be under the categories we're talking about now, then our data is a lot easier to track, and we're able to position PEMF a lot better too. Kathy, you were reading ahead. When she typed in template, which is what we were asking here. But again, it improves the credibility, and then this is how other professions matured also. So there's a consistent intake, consistent notes, consistent follow-up. So if you'd like a AOPP standard template, if we provided one and is printable, but also like Google, this, type in template here on the chat, live, of course, but then also if you wanted to, if you're watching this afterwards, again, thanks for watching. If you're watching recorded, let us know and we'll shoot one out to you. We'll get in touch with you. So then here are some common mistakes and some quick fixes. So mistake is, I only track when something is complicated. Well, the fixes track the same 5 items every time. And then I write too much and stop doing it. Well, then use checkboxes. Make it as simple as possible for you. Do a pre-printed sheet when you go out there. So you just bam, 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 bam. In my line of work, again, when I'm treating patients, I have a shorthand treatment bar, and I'm using symbols like And I do that with PEMF. So if I'm doing a double circle on a shoulder, I've got an outline of a human, and I do double circle on the shoulder. If I'm doing pad for the low back, I'll do that large triangle over the low back, and I'll draw a line. 15 minutes and what the setting was, or 20 minutes what the setting was, and then I'll make a note. Every 5 minutes, switch shoulder, or was using a 5 pound weight and doing rotations with the shoulder while using PEMF. So again, those could be check boxes. Was weight used? Yes. Was motion used? Yes. Was it non-motion? Yes. Just the more simplified you can make that, the better. And um, uh, I get pulled into medical discussions, and again, just use wellness language like we talked about. Well, do you think I've got an underlying osteoporosis? I don't know. I don't have any devices here that show it, and I'm not trained to even diagnose it. I definitely recommend you get in that conversation with your medical doctor. When's the next time you see them? Um, and then make a note. Ask me about bone density, and I referred them. Um, we call it RPO, referred patient out, RPO'd to medical doctor. So again, having some shorthand in there. If you use shorthand in your notes, make sure that you've got some sort of a ledger that explains what that shorthand is. So if you go back to it, you might have just been going, "What was I thinking when I wrote that down?" Um, if you have a set of RPO, refer patient out, PRN, which is pro rata nata, which is on an as needed basis. If you've got love language that you use, then better. I'm just reading Tina here. Um, run out of the room. But again, I change everything at once. Well, I mean, with what we're talking about today, if you want to make a grand change and swap over for 2026, that's good. But um, if it's too complex to change the system you've got, then add something. Just add one thing, what we're talking about today, and then slowly implement it. If you've got a team and it needs to be retrained, those are some things to think about. But again, one or two at a time, and slow is good. So in closing, if you want PEMF profession, ah, yes, good point, Tina. Um, yeah, and again, what do you do for headaches? I I don't do anything for headaches, but if you've got some um, pain in your neck, we can see if we can alleviate some of that soreness with PEMF. But you can't really say you treat headaches because we don't have anything in the research that says that PEMF cures headaches. So it's like, well, usually headaches, are muscle related. So I can definitely help alleviate some of that muscle soreness. So, again, just kind of steer the language away so that we have what's going on here with our profession. And if we act like a profession in consistency, that's how we do it. And so, if you can, your call to action and start this week is you pick the 60-second version of what we've got and then do it for every session. So if you can take your assessments, have it on a checklist, and it only takes you 1 minute to do it before and then after, you're only adding 2 minutes to the thing, but you've got a giant amount of information, but also you're keeping track of what's happening. And that's what distinguishes you from just a person that has a machine and want to try it out on somebody. But also, again, we would love to share our template that we've got after the live in the member portal, and I'll make sure that Lauren has it there. But use it, give us feedback, and help us improve it. And then when the next survey outcomes initiative goes out, again, just jump in there and participate. So we had a really good show up last time, but again, when you see that call to jump into our portal and give us this information, that's what makes this profession sing. But again, that's how we build a real industry in this. So again, I want to thank you for your time. We're right at a half hour here. So the universal PEMF session note template for human and animal is what we've been talking about. If you're watching this for the first time, like, what is AOPP? What's the PEMF professionals? So head on over to our website. You'll learn more about us. If you have a PEMF device and you want to know more about how to use it on just you and your family, or if you're creating a business out of this, we are the group for you. We're an international organization, 37 countries. So, and again, bring us your questions and tips. Send them out to us, info@pmfprofessionals.com. Lauren and myself, we love getting questions from people and being able to help you out with that. And then lastly, some things that you can do is like and share. So if you're on LinkedIn Live or YouTube Live or Facebook Live, hit the like and share. If you're watching a recording of it, do the same thing. Grab our link of the broadcast and drop it in yours and share it with other people. And again, we're on Instagram. We have a blog on our website, so you can read more about that too. So I want to thank you once again for being part of the family and taking time today to watch another one of our Thursday lives. And I look forward to seeing you again next week. All right. Take care and have a great rest of your day.